My slides are not advancing. There we go. So most of you are probably familiar with the Thrive Kentucky campaign by now, especially if you've been joining us every month for these updates. But this is information about our campaign and our priorities and the principles that we work together to make sure that we are really improving policies and structural and systemic policies in Kentucky that are both anti-racist and anti-poverty policies that will help all Kentuckians thrive. And again, my slides are delayed. Here is a list of our steering committee members. And here's the agenda for today's call. So we'll be covering a number of the same topics that we've covered in past months, but giving you updates on what's happened in the past month, what we're anticipating moving forward. So we'll try to give you new information, not dwell too much on what we've already shared in the past, but we will be sharing these slides so that you have a record of all of this. And if you have any questions as we're going along and you need a little bit more background, just put a question in the chat or raise your hand and we'll make sure to cover that. And we've decided that it works better to cover things as we go. So don't wait until the end to ask your questions or to make a comment. Just put them in the chat as we're going along and we'll try to get to them when we have a break in our presentation. And I wanted to do just a little bit of housekeeping before I turn it over to Dustin to do our economic overview. We have a lot of folks on the webinar today, so we want to make sure everyone is muted so we can all hear. And we will also be recording this webinar. So we'll send out a recording and the slide deck and a follow-up email, along with any other resources that we might mention on the call today. And I mentioned that we'll use the chat box for questions and comments. We're also offering CEUs for licensed social workers and for certified community health workers. So if that's you and you'd like to get credit for attending the session today, you can get in contact with me. Just respond to the follow-up email that I'll send out and we'll make sure to get that credit to you. And with that, I'm going to turn it over to Dustin. And just let me know when you want me to advance the slides, Dustin.
Perfect, will do. Well, good afternoon, everybody. Like Emily said, my name is Dustin Pugel. I'm with the Kentucky Center for Economic Policy. We have liked to start these presentations with just sort of giving the economic backdrop of the safety net and you know, this election season. And so I've picked a few slides that I thought would be a pretty decent update with data that we've received recently, just to try and give us a snapshot of where things stand. So just to start out, I wanted to say that, you know, of course, everybody knows that when COVID-19 hit and the governor issued a series of public health orders closing businesses, employment in Kentucky dropped precipitously. It was the largest single drop in our state's history. I'm actually, frankly, not sure how we're going to provide charts in the future because they go so far out of the norm, it's difficult to display, but I think this one gives us a good idea of what happened. A lot of folks were laid off. Now, the good news is a large share of the folks who were laid off temporarily. Employers knew that they were going to be coming back, and so they were able to send people home, get them their unemployment checks, and we'll talk about unemployment later, and then inevitably bring them back, which did happen, at least initially. We saw a pretty quick bump in reemployment. Temporary layoffs started to drop very quickly, and that's a good thing. We definitely want to see that happen. But at the same time, you know, the public health orders closing businesses was not the only dynamic in play. We also know that a lot of folks are staying home because they're afraid of getting sick, because they are afraid of getting exposed and making a loved one sick. And so while temporary layoffs began to fall, permanent layoffs began to rise. And so month over month, we've continued to see positive job growth, returning slowly back to where we were in February before all of this started. But we're still about 124,000 jobs shy. Even though we've regained almost 62% of the jobs we lost in April, we're still 6.4% below where we were in February. So, there is still a long way to go. New national data has come out since then that shows continued slowing in the job growth. It's still positive, but it's much slower than before, and I don't anticipate Kentucky's looking any different. So let's go on to the next slide. So, one too far. I want to scoot back one. There we go. So, what is true is that things were bad for everyone there in April, and they continue to be difficult for everyone. But it's worse for Kentuckians who are Black. And this is not new. This really is just sort of laying bare disparities that have long existed because of a legacy of racist policy that has not yet fully been corrected for. And in Kentucky, one way this shows up is that although unemployment insurance claims have reduced by 29% by July for white Kentuckians and 26% for all Kentuckians, they'd only reduced by 4% for Black Kentuckians. And although Black Kentuckians do make up a larger share of the workforce than they do the general population than do white Kentuckians, they are also more likely to require unemployment insurance, meaning they're more likely to be laid off. And that is also a product of the types of industries that they work in. We've, again, seen this in past recessions and past slowdowns, but, because COVID is so, can you scoot back one more real quick? Because COVID is so dramatic, the results have been especially dramatic for Black Kentuckians as well. We're going to get into wages in a little bit as well, but just to generally point out that Black Kentuckians tend to be more vulnerable to economic shocks as well as public health crises. And that's something that was created through bad policy and something that we can and should address through good policy moving forward. And we're going to talk a little bit about that moving forward. Yeah, Robert, you're asking if I have a contact person for unemployment insurance. I'll be honest, I did at one point when it was still with the Economic and Workforce Development Cabinet. When it moved over to the Labor Cabinet, there was such a shakeup at the top that I don't currently have contacts there, and I, like everybody else, I'm trying to find them because I have a lot of folks contacting us asking for help, and I think that's right. I'll get to unemployment later, but since that question came up now, I will say that representatives, House of Representatives members, and state senators have had some luck going directly to the Labor Cabinet. So lately, I've been directing people to reach out to their state senator or state representative because I think that that's been a pretty decent way of getting benefit issues addressed. I also know that in Frankfort, they're taking appointments. So if somebody lives near Central Kentucky, they should be able to set up an appointment and go in person to get that dealt with. All right, let's go to the next slide. There was a really good Washington Post article recently that actually broke down how severe this downturn is compared to the last several downturns we've seen, and how much worse it is for, like I said before, Black Kentuckians, but also low-wage Kentuckians. So this is a chart that you'll see another version of later, I think in Adrian's presentation. It comes from the Opportunity Insights Economy Tracker, which is a great website, highly recommend it. And what it shows is essentially if you're a high-wage worker, and high wage is not that much, it's over $60,000, then there are actually more jobs now than there were in January. Whereas overall, there's actually just slightly less than there were in January. But if you're a low-wage worker, there are 10% fewer jobs now than there were before. And again, think retail, think restaurants, think general stores like Walmart and other places. If you're a low-wage worker, this economic downturn is a lot harder on you than it is for the general population, and especially high-wage workers. So let's move on to the next slide. The other thing I wanted to point out here is that even before COVID hit, recent census data came out showing that although wages had ticked up very slightly, there were still really significant disparities in household income. So this chart shows the total household income for white Kentuckians, and then the household income for Black Kentuckians. And of course, wages are not where the economic disparities end. The Federal Reserve put out a really good, I think every 3-year report on wealth disparities that showed that the average Black household held about $24,000 in wealth, whereas the average white household had $188,000 in wealth. And again, this is an intergenerational issue. Even if we were able, and in many cases were able to reverse some explicitly racist policies, we know that intergenerational income mobility says that if you were born to a poor family, you're more likely to end up poor as an adult. And that's even more true for Black households. So there are very serious disparities that exist that can be addressed through policy and should be moving forward. And so when we talk about anti-racist policy, we're talking about policies that correct for this legacy. The poverty level was stagnant in this most recent data. It actually ticked down very slightly, but it was not statistically significant. So roughly 1 in 6 Kentuckians live below the poverty line. Again, if you are a child, it's much higher, and if you're a Black Kentuckian, it's even higher. Since then, however, we know from household pulse survey data, which is a very special new tool that the census has deployed, that half of Kentucky adults have reported losing income in their household over the last 6 months. That includes also 55% of adults in households with children, 63% of adults in low-income households, 59% of adults in Black households, and 88% of adults in Hispanic and Latinx households. So with that, I'm going to stop, just sort of keep all this train wreck in your mind as we go through and talk about our safety net and the ways that we have tried to improve policy to address the immediate needs of people who are suffering during this downturn. And I think I'm handing it over to Dr. Schuster.
Good afternoon, everyone. I'm going to talk about what we can do about some of the things you're going to hear about today. And the most important thing you can do is to vote. So next slide, please, Emily. We have passed the registration deadline, but we're now focused on people getting a ballot and who's going to be on your ballot. Obviously, the president and vice president, that important U.S. Senate seat, Mitch McConnell being challenged by Amy McGrath, all 6 seats in the House of Representatives, probably the congressional district in Fayette and surrounding counties is the one that is the most competitive with Andy Barr and Josh Hicks. Want you to really pay attention to see if you have, if your House of Representatives seat is on the ballot. There are 65 out of the 100 that are on the ballot. And of the 19 Kentucky Senate seats who could be on the ballot, those are the odd numbered districts, there are 12. I would direct you to our Advocacy Action website, which is www.advocacyaction.net. We have a county by county listing of every district, and you can, Marcy just put it in the chat. Thank you, Marcy. So you can look up your county and see whether you have a competitive race on your ballot or not. Next, please, Emily. So the important thing is that we have a deadline coming up, and that's this Friday at midnight. October 9th is the deadline for going to the state portal, which is www.govotekentucky.com, govoteky.com, to request your absentee ballot. It is really a very simple process. And since you all are all registered, all you have to do is to enter the information that's requested in terms of where you want the ballot sent, your social security number, and so forth. Many of us registered even back in August and are still waiting for our absentee ballots to be mailed or for us to receive them. So don't panic yet. They are in the mail. They have to be postmarked no later than November 3rd, which is election day, and they have to be received by November 6th. And I really want you to pay attention if you're going to do an absentee ballot, particularly if you did not do one in the primary, because so many of the primary ballots were thrown out because the directions were not followed. You have to mark your choice. They suggest a black pen. You have to sign both the inner envelope and the outer envelope, and make sure that you keep that flap intact. They will not process your ballot if you do not do that. There is first-class postage on it, so you can either put it in the mailbox, or there are collection boxes at each of the polling locations in every county. Next, please, Emily. So there also is extended in-person early voting, and that's going to begin on October 13th. You do not have to make an appointment. The hours, I think, are 8 to 4. I think maybe in Jefferson County it's 8:30 to 4:30, but they are open for at least 4 hours. Again, in Jefferson County, I think the Saturday hours are also the same as the Monday through Friday hours. So you essentially have 5 days a week for the next 3 weeks. I know in Jefferson County, there was a huge uproar because there was only one polling location for the primary. They have submitted to the Secretary of State 20 polling locations, and all of those are what they call super centers, which means that regardless of what precinct you live in other words, what your House or Senate district is, you should be able to go to any of these polling locations and be able to vote for everything that's on the ballot. So that's a really important way. We're hoping that a lot of people will take advantage of the early voting and that people will kind of spread themselves out so that there won't be any risk of COVID transmission. Obviously, you will want to wear a mask. If you're going to go with somebody, go with people that you're already kind of quarantining with or living with, and make sure you keep yourself socially distant from other people that are voting. Voting in person on election day, all of those polling sites will be open and the hours will be the same. There's been a lot of talk about extending the hours on either side of 6 a.m. and 6 p.m., but that would take legislative action. So your polling times on election day, which is Tuesday, November 3rd, exactly 1 month from today, will be from 6 a.m. to 6 p.m. Some of you may remember, and we fought against it, that the Senate put forth a requirement for, quote, an official ID, which you would have to vote. And while that legislation passed, because there's no way to get an official ID from some of the likely places that you would get it, you do not have to have some official ID. What you do need to have is some identification that you live at the address that you have registered for. So they say that even bringing, for people who have not voted before, don't have a voter card, if you don't have a driver's license or a passport, bring something that shows that the gas and electric company has sent you a bill at your address so that you can demonstrate your address. The other thing I would point out is if your right to vote is challenged at the polls, you should insist on asking for a provisional ballot, and you should go on and fill out that ballot, and then you should get in touch with the county clerk in your office or the Board of Elections to make sure that whatever question was raised, you can answer that to make sure that your ballot is counted. There are officials that are supposed to be there. I've not heard about some of this poll watching that we're hearing about nationally. There are limitations on the people that can be inside the polling place, and there also are limitations on how close to the entrance to the polling place. So don't let someone intimidate you if that's what you're concerned about. You have every right to vote, and it's probably the most important election of our lives. So I will end there. If there are any questions, and I didn't look in the chat to see whether there was anything, but I will turn it over to Emily to talk about good news about the census. Thank you.
Thank you, Sheila. I don't see any questions in the chat at the moment, but if there are, we can address them a little later. So I just wanted to very quickly share the good news that Sheila mentioned about the census, which is that if you have heard that the date that the census is ending, that the actual count where people are on the ground in our communities is, ending at the end of September or on October 5th or whatever day we may have heard, there is a lawsuit that it's ongoing, and a federal judge has ruled again that the census must continue through October 31st. So that is where we're at now. Of course, this could be appealed. That would have to happen very, very quickly. And so at the moment, we are continuing to have census folks out in our communities, going to doors and doing the count. And of course, the online census is still available. So it's really important that we spread the word, let people know that it's not too late, that they should, if somebody comes to their door, that's legitimate, as long as the people who are coming through the door provide, their identification and aren't asking for information like your social security number, which a census worker would never ask for. These folks are legitimate. They're still in our communities, and they really need our help to get a good count for Kentucky. Right now, our response rate is about 68%. I read earlier today that we are around 43rd or 44th in the country. So that's really not good. That's not where we want to be. And just as a reminder, I think most people on this call probably know what's really at stake here, but we risk losing over $2,000 per uncounted individual per year in federal funding that go to incredibly important programs like Medicaid, to schools, to infrastructure, to so many things that we rely on and need in order for Kentuckians to thrive. And so we need to have this, full count. And in addition to the funding, which is critical for thriving, it also helps us ensure that we have fair representation. So, there have, in the past, states have lost, and Kentucky did many years ago, a seat in Congress because we had a low census count. So there really are consequences to having a low count. And we need to make sure that people understand what's at stake. Voting is incredibly important. Another way to be counted is to complete the census. So please spread the word. And if you go to that link, there are also lots of other good tools that are available. So I will now pass it along to Adrian and Ben if he has made it on our call yet.
I am here, yes. Hi, we're going to talk about evictions and housing assistance. Can you all hear me okay?
Yeah, we can hear you.
Okay, great. The big update for evictions, we can go to that first slide. We have had a lot of twists and turns in the last 6 months of this pandemic, but where we are now is that all evictions in Kentucky are going forward, except if you are a renter who has filled out the CDC's declaration form. Landlords are not allowed to prosecute evictions against you for non-payment of rent. And so, sort of like it's important to spread the word about voting and the census, because home renters have to take action, it's incredibly important that we include in our messaging the need to fill out a declaration form and send it to your landlord. The declaration form itself, you can go on to the next slide, is super simple. It's literally just signing and dating. So if people have renters in their office, obviously just have them sign and date it if they can truthfully swear to the things in the declaration. For those people who are talking to folks on the phone and who might have access to the internet and their landlord's email address, we built an app at homerenterdeclaration.org that allows people to review, sign, and email that declaration to their landlord all within the app. And so that app has been used by thousands of people around the nation. It's useful to anyone in any state. And so if you have national partners or friends who are doing this work across the river in Indiana or Ohio or wherever, this app that we've built can be used by anyone, and we encourage people to use it. So we can go to the next slide. One thing that I want you all to appreciate is that the protections in the CDC order, which came out of the blue, I mean, they announced it on September 1st, nobody was expecting it, and it went into effect on September 4th, are very broad, and it prohibits the landlord from taking actions to remove people or cause the removal of people from their dwelling. And so on our side of the advocacy world, we're saying that means you can't even file an eviction if you have received a CDC declaration form. But the other piece of this is you'll see that covered person definition is any person who has given their landlord a signed declaration. Okay, that's sort of important for the legal advocates on the call, just because you'll have landlords arguing that judges need to get into whether or not the person is lying about whether they made $99,000 or less, or whether they've made their best efforts, have a judge determine whether someone has made their best efforts to get rental assistance or make partial payments. The definition of covered person does not include that, right? And all the definition includes is someone who has signed the declaration and sent it to their landlord, and that's what we're sticking to. And then next slide gets to sort of the final point on this. Nope, sorry, I missed this. Forgot about this slide. This is what the person will have to sort of swear to, and it's just basic facts about your income, your attempts to find rental assistance and make partial payments, and swearing to the fact that if you do lose housing, you'll have to either become homeless or double up with somebody. And that's obviously what the CDC's order is intended to prevent. And we'll go to the next slide. The point on this next slide, I hope, is, nope, that's not it. In the CDC's declaration, it prevents the removal of a renter. And so even if you have somebody who is post-judgment in the eviction process, who signs and sends that declaration form, in other words, they've already had their day in court and they lost, if they sign and send that declaration form to their landlord, it should, and you'll need a lawyer's help with this probably, it should prevent the removal of that person even after the judgment if they sign and send that declaration form to their landlord. So again, the app does two things. It allows people to sign and send that declaration from within the app, and it also delivers an email to the renter's email address to confirm delivery. But the second thing it does for people in Kentucky is we go through a number of steps to connect people to their legal aid organization within their county. And so we provide people county by county with the phone number for legal aid, because unfortunately a lot of the protections that the CDC's declaration, that should be automatic under the CDC's declaration, really require a lawyer to make sure that the renter is able to stay healthy at home under this order. I think that's got it for me. Yeah, we can skip this. That's just basically explaining why it's so important to have a lawyer. And then the last piece of this is we have a flyer that we've put together, and Adrian can tell you about that, but there are links in the PowerPoint that you'll get that allow you to download the flyer if any of you are doing like door-to-door outreach.
Great. This is Adrian Bush with the Homeless and Housing Coalition. And if you would like us to send you these flyers, we're happy to do so. You can order them through clicking that link, or you can just send me an email and we will get them to you. Okay, so with all of this change and upheaval, I want to talk briefly about the folks who are at risk of evictions. Last month, we talked a little bit about the 211 calls that are coming in and what they're concerning. And in Metro Louisville, the 211 data for the last month still shows that 35% of folks are calling for housing and shelter needs. That's a little bit of an increase from last month. And then of the housing and shelter requests, 65% are for rental assistance, which is also an increase. There are a couple of notes I want to highlight here too. The next highest volume of calls is for utilities, which is not great, given that the moratorium on utility shutoffs is phasing out. So it's not a surprise there. But there is some good news, and I just want to highlight that it looks like statewide 211, which we have never had in Kentucky, will be coming through the new Connect. So next slide. What all this means for Kentucky home renters. Basically, 47% of all home renters think it is somewhat to very likely they will have to leave their home due to eviction. This data was captured right in around the CDC order. So, some of the folks may have responded before the CDC's order came out. But I think one of the takeaways here as well is that implementation of the CDC's eviction moratorium has varied wildly across Kentucky counties. And so people are very unsure about what protections they may have under this. Yeah, nearly half of all home renters and over half of all Kentucky renters who are Black report the same. Next slide. Okay, the firm Stout actually has tried throughout the pandemic to estimate the numbers of folks unable to pay rent and at risk of eviction, and they continue to estimate that about 130,000 to 200,000 households in Kentucky will not be able to pay their rent within the next 4 months. Estimated eviction filings by January 2021, which is when the CDC eviction moratorium ends, is 120,000 households. Unfortunately, many evictions are still going on for other reasons, ostensibly. And so this figure just continues to kind of loom in the back of my mind, right? So, and then the estimated range of rent shortfall by January 2021 is anywhere from $236 million to $350 million. Just for context, the coronavirus relief fund rental assistance for Louisville was $21 million. So next slide. Okay, so the good news is we do have rent assistance available in all 120 counties. This is the first time I've been able to say that since these webinars began. Statewide, which for this purpose means all 120 counties minus Jefferson, there is $15 million available in CARES Act state funding designated by Governor Beshear. And I've got the application portal for folks. Both landlords and home renters need to jointly apply. Both must have an email address and there has to be a lease in place. But if there isn't a lease in place, you can do it as part of the process. So, and then in Lexington, we have a little bit less than 1.5 million available, and the portal is there. as well as Louisville has its rental assistance portal, and is also, it's at the bottom of the slide, it's stopmyeviction.org. Okay, and with that, I will turn it over to Dustin Pugel with unemployment insurance.
All right. Hello again, everyone. Unemployment insurance seems to be a perennially important topic, very understandably on these webinars. So I just have a couple slides today to give updates on. We're sort of in a holding pattern until Congress can provide an additional round of extended benefits. So we'll just cover a couple things here today, and then if there are questions, I'm happy to ask them during this time too. Yeah, why don't you go advance it? All right, so just again, I know I keep saying this, but we really have seen an unprecedented level of UI claims in Kentucky and really around the country. We've never seen anything like this. I've got this chart here on the left that represents two different types of claims. One is initial claims, which is what it sounds like. These are first-time filers. It's possible that there are repeat initial claims in here, as especially in March, a lot of people applied, didn't hear back, and may have applied again before the first claim was dealt with. But in any case, it really was an extreme number of claims. The highest we ever got during the Great Recession was 25,000 initial claims. And if you look at that darker blue area there at the top, those are continued claims. And again, that's what it sounds like, people who asked for more than one payment. And again, we've never seen anything like this. I think the peak during the Great Recession was 100,000. So the peak was for continued claims was below where the initial claims were. And although initial claims have trailed off, especially as a lot of folks have gone back to work and there are fewer and fewer layoffs occurring, continued claims have dropped, but they've still remained really elevated. I think this last week was the first week that we hit the peak of the Great Recession. And so, I don't anticipate that changing a whole lot over the next several months, because I know a lot of folks are still requiring those benefits. So, during the week that ended September 26th, there were 7,200 new initial claims, over 100,000 continued claims, like I mentioned. And then this special program called PUA, or Pandemic Unemployment Assistance Program. It's for both folks who are sort of non-traditional employees, and then possibly traditional employees who do have a job waiting for them, but don't feel that they can go back to work, either because they're caring for a loved one with COVID, they have COVID, their child care center closed down due to COVID, and other COVID-specific related reasons. And there were still 51,000 continued claims in that program. Interestingly, the new and continued claims for PUA has stayed pretty stable over the last several weeks. And again, I think we could probably anticipate that staying the same. Although unemployment insurance is a regular program and it will be there indefinitely, PUA actually runs out at the end of this year. And we only have about 3 months left in the year, again, unless Congress takes further action. So we do need to really see some quick movement from Congress, which I know these days is asking a lot. But that is something that needs to happen, or else a lot of folks in Kentucky and across the country are going to lose really vital jobless benefits. So yeah, let's go to the next slide. I wanted to just give an update on the Lost Wages Assistance Program. Folks may remember that at the end of July, PUC, the Pandemic Unemployment Compensation Program, that extra $600 per week expired. And although there were some negotiations, ultimately a deal fell through to extend some form of added benefit, which is really problematic. PUC was an incredible boost to our economy. There were $3.4 billion in special federal unemployment compensation programs 3.3 billion of that was PUC all by itself, which helped really prop up demand, which helped prevent further layoffs. And by one estimate I've seen, if we don't provide any extra benefits over the next year, that could cost Kentucky as many as 50,000 jobs. However, the president wrote a memo directing FEMA to pull some money out of its emergency fund for things like hurricanes and wildfires, and instead direct that toward a $400 per week benefit called the Lost Wages Assistance Program. This bar graph here represents an estimate for the amount of money that came into Kentucky through PUC over the several weeks that it was here. It regularly topped $100 million a week. It never really fell below 80, except for that very first week. And that, that's a huge amount of money. And then with the Lost Wages Assistance Program, it was only good for folks who received regular unemployment insurance, so not PUA, and whose benefits exceeded $100 per week, which left out a lot of really low income folks. The governor estimated that that was about 80,000 folks. And so really we only brought in about $32 million per week through the LWA for the last 6 weeks. At this point, that money's gone. And so we're back to nothing other than the normal unemployment insurance benefit, which has been shrinking. It's only about $280 per week now for Kentuckians. Really the point here is that this is not a substitute for a full $600 per week benefit. We really critically need to have that re-upped, and it needs to be pegged to the economy, not some arbitrary end date that we hope that things will get better by. Because even after we get a vaccine, even after we find some form of treatment, the layoffs and the economic pain is going to continue into the future. The last I've seen from the Federal Reserve is potentially into 2023. So it's just a really important thing to keep in mind that is not only helpful to the folks who have lost that income, but helpful to local economies as well. So with that, I will hand it over to Jessica.
Hi, I'm Jessica Klein with KSEP. I'm going to talk a little bit about our food assistance programs and some flexibilities in those. So next slide. As you may know, many national reports have shown that hunger and food insecurity has increased significantly since the pandemic. Now in Kentucky, over 1 in 7 adults has food insecurity. And that's particularly in households with children and in households with Black and Brown families. So since February, you can see this chart here, an additional 120,000 Kentuckians have used SNAP to buy groceries, and that's a significant amount increase. SNAP is a critical anti-recession and anti-hunger program. So every $1 in SNAP is almost $2 into local economies. Next slide. So some of the specifics and flexibilities in these programs I want to mention. One is that the Lost Wages Assistance Program that Dustin just mentioned does not count towards eligibility. So one message we're repeating is if you've been denied in the past, definitely apply again, and that includes being denied because of unemployment benefits. Another update is that the emergency SNAP benefits, which provides the maximum amount for your household, just got approved for October. So you should see several households getting those this month. And last month, recertifications for the SNAP program began again. But one of the pieces in the CR, which was the continuing resolution just passed, says that we could reestablish those. A few other things in that CR is the flexibilities around, in-person appointments, putting some flexibility there, self-verification, over the phone verification, that kind of thing, and also for both SNAP and WIC. But one thing we still would like to see is that increase of maximum benefits by 15%, which means that all Kentucky households on SNAP would see an increase to their benefits. Next slide. And then the other program I wanted to update you on was Pandemic EBT, PEBT. And there are some differences here throughout the month, so it's going to get a little complicated for a minute, but First, I'm going to talk about the August and September allotment. So that is just for school days missed in August and September, and that's for over 600,000 students eligible. And to be eligible, you have to be in a school that participates in the free and reduced lunch program, and that school also has to have virtual classes or a hybrid with at least 5 virtual days in a row. So for each day missed, the child will receive $5.86. So it's kind of hard to say a specific number for students just because schools will vary based on how they're doing virtual classes or how many days they've missed during those months. But there is no application this time around. So the student will automatically see that card in the mail. It's a little white card. It looks like a credit card. And it will have the student's name on that piece of mail as well. And that'll be anytime this month or in November that those will be automatically sent out. And then what was approved in the continuing resolution is moving forward. So that's October through September 2021. So the rest of this school year and next summer, we'll see some expansions in the PEBT program. So it will be based on school districts and not individual schools. So more schools might be eligible. And it also expands to younger children in CACFP approved child care centers. So we're learning more as the month goes on from the cabinet on how that's actually going to be implemented. But this is what's been approved, and the state will also receive federal funding to administer that program. Next slide. And just a few more resources I wanted to share out. WIC, again, a lot of these are very regional programs, so it will really vary based on where you live, but we've seen some improvements and flexibilities in WIC, so you can reach those at your local health department. Many different congregate meals for seniors have been given out as drop-off sites or weekly pickups, that kind of thing. So there's resources there at area agencies on aging. And then meals for kids can be found by texting this number, and that's in addition to PEBT funding. So you can also go and pick up meals in addition to getting that cash for groceries. And then all of our local food banks can be found at feedingky.org. That's it. On to Emily, I think.
All right, thanks, Jessica. So I have some more good news to share. I got lucky this time. It's not all good, but I decided to move some things around in how I was going to present this because I just couldn't help but talk about Connect first. And hopefully everyone saw the announcement yesterday. Governor Beshear had a press conference and announced that Connect is back. And this is something that we have been asking for since the administration took office. We knew with Governor Beshear making healthcare one of his priorities and saying and really continuing to reinforce that healthcare is a human right, we knew that Connect would be a great way of reaching this goal of making sure that all Kentuckians have access to affordable coverage and less red tape to get enrolled in coverage, to keep their coverage. And in particular for Black and Brown Kentuckians who experience more disparities in coverage and in health outcomes. And so we have really been putting good pressure on the administration to do this. And we knew that the administration was hoping to bring back the state-based marketplace for next year. So in 2021, we will have the marketplace as a state-based exchange again, so that you can enroll all in one system, and there will be no more going to healthcare.gov. That couldn't happen this year because of just timing issues. CMS has certain deadlines that you would have to meet in order to stop using healthcare.gov and bring that enrollment back to Kentucky, and we simply couldn't meet those deadlines. So we were really thrilled when the state decided that they were still going to roll out Connect in its current form, which is really just an enhanced online portal for not only healthcare with Medicaid in particular, but other benefits and resources that are in a one-stop shop, easier to access, less red tape, and more assistance with connectors who are in our communities, trusted resources on the ground, helping people, providing one-on-one support. So that's really the beauty of Connect. If you've been following this for many years and really involved in the implementation of the ACA back in 2014 and 2015, I think we all remember how well Connect worked. Kentucky was leading the nation with the drop in the rate of uninsured, and it was because we had such a good system that was built by Kentuckians for Kentuckians. It's an integrated platform. It will be next year. Again, that integration is the part where we have to bring the healthcare.gov enrollment back to Kentucky. But this is absolutely an upgrade from Benefind, which is what we've been on for the past few years. Honestly, Benefind was always meant to be connected with Connect. That was the Steve Beshear administration's plans whenever they originally designed this. And so this is just kind of getting everything back on track. So I'm calling this Connect 2.0. And what I found really great about this yesterday, yesterday was the first day that I saw the new website too. And if you haven't seen it yet, connect.ky.gov is the exact same URL that we have had. But it is live again, and you can see what is available there. So they have created 3 buckets essentially: health coverage. So right now that's going to be Medicaid and K-CHIP. In the future, and it connects you with the Health Benefit Exchange and with healthcare.gov. But again, people will still have to shop for marketplace plans on healthcare.gov this year. In the future, all of that will be in this bucket. And then benefits, so that includes SNAP and PEBT, which Jessica was just talking about, also child care assistance and other types of emergency aid and financial support for children and caregivers, which we typically call KTAP, and other benefits as well. And then resources. And resources is the newest component and the most sort of enhanced. And I wanted to show you how those resources are sort of split between different groups. So looking at, kids who may be former foster care or also foster parents, people who are unemployed, senior citizens, people who are perhaps incarcerated and reentering their communities and need support for that, people who are experiencing homelessness or impacted by substance use disorder, and pregnant women, immigrants and refugees, and veterans. And so when you click on those tiles, you see various resources, and a lot of the resources that we've shared today will hopefully be available in this one place. I'm sure that this is a work in progress. It's probably going to need to be improved. And so what I would ask of you is, if you are using this system and you think that something is inaccurate or is missing or could be better, share that information with me, with Kara, and we will be communicating that to the cabinet. We are participating in various work groups, and so we really want this to be sort of continuous improvement, just like it was when we first had Connect. We made lots of improvements that first year to make it work better for folks, for information to be more accessible, easier to read and understand and act upon. These are the kinds of improvements that I anticipate seeing here as well, but we need to hear from you if there are issues that need to be fixed. And just to say a little bit more about what you can expect right now with Connect, we will have connectors who are much more visible in communities. There's going to be more marketing than we've seen over the past few years. So hopefully people will be a little bit more aware of what assistance is available to them, what options for enrollment are available. And then, like I said, easier enrollment options, less red tape, so that if you're eligible for something, you can easily enroll in it and get the help that you need to get back on your feet, to take care of your family, to improve your health. So that's really what I think we can expect initially. Marketplace coverage is going to be integrated for next year. Now, the legislature does have, some say in this, so we're really hoping that people will be supportive of Connect and talk with your legislators and tell them how much, and I'm talking about state legislators, how much Connect means to you and to your community, why you think it's important, because we want to make sure that the administration has the option to bring it back next year. And something I didn't put on the slides, but the administration has shared this information. This is going to actually save us money. By bringing everything together, it's really much more cost effective. And we're leveraging, dollars for Medicaid enrollment and combining that with enrollment in these other programs. And by doing that, we could save Kentucky about $15 million a year. And there are fewer fees on Connect on a state-based marketplace than on healthcare.gov. So the people who are enrolling in those plans will also see fewer fees. So for many, many reasons, this is a great deal for Kentucky and going to be a real benefit for Kentuckians who need access to these programs. And then the new resource engine that I mentioned, that's really new. So we need to make sure that's working well and improving. And then we've talked a little bit about 211 on this webinar. So 211 isn't available right now in every county, but that is changing. So the cabinet is working with United Ways and they're expanding 211 to all 120 counties. So just one more way that we'll have more consistent information and access to resources. So Medicaid options. I've shared this before, so I won't dwell on it, but I do just want people to remember that we have 2 Medicaid options right now. Typically, we call the, regular Medicaid means you have to be income eligible. And income eligibility is based on your federal poverty level. So 138% is about $17,000 for an individual, about $24,000 for a family of 4. I think that number is still right. And so if you fall into that income bracket or below, you're very likely to be eligible for regular Medicaid. It's about 1 year of coverage if you do all the paperwork. If your income is over that, we have something called temporary Medicaid or presumptive eligibility right now during the pandemic. And this is something that is available tied to the public health state of emergency, which is set by the HHS, Health and Human Services, so the federal government. And so as long as we have that public health state of emergency, we will very likely have temporary Medicaid, which is available for about 90 days, depending on when you enroll, and available to anyone who's uninsured and under the age of 65, regardless of income. Of course, you can't have other type of health insurance, but very few people would be denied this presumptive eligibility right now. And there's some flyers there that you can click on. These links go straight to the applications for regular and temporary Medicaid. And I've mentioned on our last call, there's this campaign targeted to Black and Brown Kentuckians who are more likely to be uninsured for reasons that are often related to red tape and other barriers that they may experience to getting coverage. And this campaign is called 123 No Cost to Me. You may see some of these signs, billboards, commercials running depending on where you live in Kentucky and the population in that area. And I wanted to share just a little update on what coverage looks like right now. So this is a graph that Dustin put together for us. And you can see from the beginning of 2018, we had this, just slide almost monthly in enrollment. And there was so much red tape happening at that time where system changes, even though that 1115 waiver, Kentucky Health never went into effect officially, there were a lot of system changes happening in the background that created barriers and made it more difficult for people to either enroll in the first place or to recertify, which is, re-enrolling for the year. And there was also a chilling effect there. People heard that it was going to be more difficult, that you had to prove that you were working or doing other things. And it turned a lot of people off. It was discouraging. So what we see now is what we like to call a welcome mat effect. And when you make it easier for people to enroll, and again, these are people eligible for coverage, but when you make it easier, more accessible, and you remove those barriers, you see more enrollment. And that's exactly what we need during a pandemic. I mean, there is no better time to have people enrolled in health insurance than during a health crisis, and to make sure that people have access to care if they get COVID-19 or if they have some other health condition during this pandemic, so that they aren't delaying, seeking care and getting the treatment that they need. So we expect to see that number continue during the pandemic. And then as the recession improves, of course, that number will go down. But we really need to continue making access to Medicaid available at this time. And that's something that we need Congress to help us with. So just a little more information about open enrollment. I don't have a whole lot of details for you right now. I did want to share the dates again. Marketplace open enrollment starts on November 1st. Medicaid managed care open enrollment starts on November 2nd. I'm not sure what the difference is there, that 1 day difference. And then we are about to start Medicare open enrollment October 15th. So that actually begins first. But I wanted to just mention very briefly that Medicaid open enrollment information that we probably shared actually in one of our emails. That information has been put on hold because there is a lawsuit. Anthem is suing because they lost their contract, and right now there's an injunction, so information can't go out. We're hoping that information will go out before November 1st or November 2nd, which is the start of that open enrollment period. But every MCO is going to have information. We're trying to find ways to compile that information as much as possible so that it's easier for people to see what their options are, what the differences are between MCOs, differences in networks, differences in what we call value-added services, which is like eyeglasses for adults, because those aren't typically covered for Medicaid, dental services, things like sports physicals that are also not always covered. And so we want people to be able to make, the best, most informed choice for themselves and their families, and are working on getting more of that information from Medicaid. Information will be out. It's a matter of when. So the option isn't to enroll in Medicaid. Medicaid enrollment is year-round. But what happens during this open enrollment period is that you get to choose change your MCO if you want to, if you're not happy with the one that you have now. And because we will have 2 new MCOs starting in 2021, more people will want to know what the differences are and make that choice for themselves. Now, Passport won't exactly be new, but it will be operated by Molina Health. And so Molina has purchased Passport, so the network and also, the brand. And so it will be probably operated a little bit differently, but we hope to see a similarity in the network and in the services that they're providing. And right now, we don't know exactly what the marketplace plans are going to look like for 2021, but we do know that there have been some rate increases. CareSource and Anthem are the 2 insurers that continue to offer these plans. There is a coverage map that I linked to, which may not be updated yet, but will be by the time open enrollment starts. And again, whether it's marketplace coverage or Medicaid coverage, you can find a connector to get help with that enrollment. And finally, I wanted to talk just briefly about the ACA lawsuit, which is sort of clouding all of this progress that we've made. The ACA lawsuit is something that began, I think, back in 2017 when there were 5 ACA repeal attempts that failed. But then Congress passed a law where they zeroed out the individual mandate, what that otherwise the penalty would be for the mandate. And so they made that 0, which meant that, some pieces of the law didn't work as intended. Now it's still working pretty well, honestly. The mandate's not there, which really encourages people to enroll in a plan. And that helps us, lower costs for everyone, the more people you have in the pool. But there has been a lawsuit, and the Trump administration has chosen to continue this lawsuit, even though there is absolutely an administrative and a congressional fix for it, which is you just increase that penalty to $1 or restore it to what it originally was, or improve upon the ACA in lots of ways that we all know it needs to be improved upon. But this lawsuit is absolutely unnecessary, but it is going to the Supreme Court nonetheless on November 10th. So just 1 week after the election, this will be heard in the Supreme Court. So there is a lot at stake. And what you can see here is that, protections for people with pre-existing conditions is at stake. Medicaid expansion, the Medicare donut hole, which has been closed, could be reopened. Discrimination against women and older adults in the form of charging more. Premium subsidies and discounts are at stake. Lifetime caps on coverage, which have been removed, could be replaced. And essential health benefits that have really made coverage more comprehensive could also be cut. And what that really means to Kentuckians is that we could see our rate of uninsurance increase by 150% in Kentucky. We could see over 400,000 Kentuckians lose coverage altogether and be uninsured. 1.8 million Kentuckians with pre-existing conditions could be denied coverage or charged more in order to have coverage. And we could lose about $4 billion in federal funding a year. So a lot at stake. And like I said, Congress can absolutely fix this. The Trump administration could drop the lawsuit. There are lots of choices here that we have. So we want to see that happen. And I think that's it for me. I'm going to turn it over to Marcy to talk about behavioral health and substance use disorder treatment.
Hi, folks. I'm Marcy Timmerman with Mental Health America of Kentucky, otherwise known as MHA Kentucky. Go ahead, next slide. This is Mental Illness Awareness Week, so thank you for joining us during that. And our channels are doing 7 ways for 7 days to get involved with mental health. Just a little plug there. If you're interested in that, go to our websites and our Facebook. And Thursday is National Depression Screening Day. I wanted to mention that to folks. If you or a loved one is having some issues during COVID, please make sure you take a depression screening. Ours are free. They're at mhascreening.org. I'll drop that link in the comments later. But just something to keep in mind. It's always good to get a checkup from the neck up, as they say. And it's a good way to do it and a good reminder to do that this Thursday. Saturday is World Mental Health Day, another excuse for a checkup for the neck up and to talk about mental health. So this week is just packed full of it. We are dealing with 2 pandemics right now, COVID-19 and racial injustice. Both have significant mental health challenges. Those of you who have seen this slide before, I'm sure it's a different thing. It will affect all of us though, and we're going to feel it and express it differently. And I will say that how we all react to these things is going to change every single day, right? It's not going to be just one person has one set of symptoms or one issue. It's going to happen all the time to all of us. Anxiety and depression are the most common. We have seen in over 1 million screenings since the beginning of January. We have seen a severe increase in anxiety and depression happening across all of our age groups. So we're seeing more calls to crisis helplines, including local ones, which is good. Unfortunately, we're also seeing more overdoses and more suicide attempts during these pandemics. So we are wanting to keep that mental health piece front and center, and what better week than Mental Illness Awareness Week to do that. Couple of mental health tips that are just general to all of us is to get daily exercise. I know it's really easy to get in a Zoom funk and just sit in your chair all day. Make sure you're getting up, walking around, getting some extra exercise on purpose. Stick to a routine. Create whatever routine works for you right now, which has been really challenging with us who have NTI, kids at home and things, but getting some kind of routine in place is really helpful. Minimize your alcohol use. If you're using other substances, minimize that use as well. Reach out and connect with others, right? I know people get Zoom fatigue sometimes. That's a legit thing as well, but it's important to have some of those cocktail hours, those support groups, those socially distanced outside events are a good thing to have. Make sure you're talking about how you feel during COVID-19 and during all of the other unrest that's going on right now. Have people in your life that you can talk openly about all of those issues too. Make sure you're listening too. Being a good listener is really hard, but it's really important to listen and to listen without judgment, especially in these times. Get help if you feel overwhelmed or desperate. There's a ton of information out there for you. We've got a COVID-19 resource page on mhaky.org. I'll drop in the link as well. But that's just one place. There's lots of material out there right now. You can always call a crisis line at your local community mental health center. I will put those in the chat as well. And there's always a suicide prevention helpline at 1-800-273-TALK. You can also text the crisis text line at 741-741. So if you don't want to actually make a phone call, you don't have to. Millennials. Next slide, please, Emily. But that's all kind of important information, but we wanted to make sure we get to this. There is a new 1115 waiver amendment pending for treatment during incarceration of folks that have substance use disorder. What we do know is that substance use disorder is one of the leading causes that people go to jail or to prison. But we were not offering enough services, or in some cases no services, for substance use disorder treatment, especially in the jail situation. Sometimes, all the prisons had some kind of services, but not a full slate. So the General Assembly made the Department of Medicaid Services work on an amendment to their existing waiver. And it looks like we are going to be getting treatment even during the pretrial period, which is really important. Before someone's even officially sentenced with something, they can start access to treatment and possibly get out of that cycle, that revolving door between hospital, jail, and community, back to the hospital or jail and community. We're really wanting to disrupt that, and I think we can do that with this. Medicaid will be reimbursing for substance use disorder services that are offered inside at that time. So that is something that they don't do now. And that will hopefully help us increase the amount of services even available by having that reimbursement. If it's approved by federal CMS, Kentucky would be the first state to have this. So this is something that we can be the first in. We were the first to get a Department of Mental Health back in the 1960s, and we can be the first to work on substance abuse treatment inside the jails. I think that's really important. There are 2 virtual town halls coming up. Make sure you go to that link. I'll drop it as well in the chat, just to make sure everybody gets a chance to hear more about it, but also provide public comment. That public support is going to be really important, I think, to get this through. Go ahead, next slide.
Yeah, thank you, Marcy. And I just wanted to say that we will be putting out information about those forums or the town halls. And we'll also be putting out a survey probably in a week or 2 to collect comments. So that'll make it easier for people to comment. We'll make sure to get that information out to everyone on this call. And it would be great to have your help spreading that to your networks. And now I'll turn it over to Kara.
Hi, everybody. I just tried to click the next slide button like that was going to work. So what can we do about any of this? Of course, the answers have to come from Washington, D.C. for a lot of the problems that we've heard about today and some of the solutions. So what's happening in Washington, D.C. is actually a little bit of something. You can go to the next slide. Emily, I watched you touch it. So we have made some progress. I know people that have been on these calls before, you've heard about the CARES bill. We all experienced the CARES bill. That was back in March, $2.2 trillion. And then in May, the House passed the HEROES Act, which was a pretty comprehensive, not all the way perfect, but really good $3 trillion legitimate package to provide relief from all of the crises that have been created by COVID-19. And then the Senate introduced a HEALS that ultimately failed as a separate sort of skinny bill in the Senate. And now just, last week, October 1st, the House passed HEROES 2.0. It is a compromise that is still got the core components held tight, still adds back that $600 unemployment protection, enhances tax credits, and does a lot of the necessary pieces from the CARES, extends the things that are expiring, adds in significant rent relief, but was made in good faith as a compromise between the White House and the House of Representatives. So, and then I came into this meeting very hopeful for HEROES 2.0 and was going to say, hey, and I still believe we should all reach out and demand that there be COVID-19 relief legislation heard and passed. But I can't fail to share that Dustin noticed that about 25 minutes ago, President Trump tweeted that he was ending negotiations. So we still need pressure. It's just the pressure is slightly different. And so we can't ignore this, right? We can't go on without having federal COVID-19 relief.
And right now, I feel like a lot of people are being held hostage, waiting on the election. So still make those phone calls. I didn't make phone calls the last 2 weeks, and as soon as I started thinking about this today, I felt really guilty. So make your phone calls today, make up for any ones you've missed. And whether it happens before or after, like Emily's saying in the chat, it still has to happen. We have to have relief. Our state and local governments can't afford it otherwise. So it's still time to go. You can hit next. And then some of these are just review slides we kept in. This is just in here for reference when we go through, so you can go ahead and move on. That's what that's the best bill that's been proposed, was the HEROES 1.0, but this is where we're at with the negotiated compromise. And again, that's for reference. I mean, it includes the core stuff. You can go ahead to the next slide. So what to do is tell Congress we've got a letter that you can click on there to share. We've got a survey that you can fill out and that will lift your voices up and add to the story map. You can call directly. And then the next slide. And of course, everyone will get this. So you can click on the links like that. Click to send a letter is a link. Because we have to continue to demand that Congress pass comprehensive COVID-19 relief. I mean, there's no way around it. We have to. And that protect the ACA, like Emily talked about in what is now known as California v. Texas case that started out as Texas versus the U.S. You know, the United States government could choose to defend the ACA and not let this lawsuit go forward any minute. But that doesn't seem likely, given that President Trump has said he's not doing that. Or Congress could fix it. So, I mean, it's a law, and we can demand that our representatives in Congress protect our care and protect the ACA.
Yep. Thanks, Kara. I just wanted to go back to this story map really quickly. If you do want to reach out to any members of Congress or even state representatives and senators, you can share a link to our story map, and it includes all of the stories that we've collected about people's experience with COVID-19, how it's impacted them personally, their families, their communities. And these are the stories that we collected through our various collectors. But if you recently saw the sign-on letter and you may have signed it and shared your story or sent it to someone and asked them to share theirs, that's where these stories are going. And so they're there by county. You can search by county and by topic, and there's a COVID-19 topic. And so that's really there so that we can continue to really lift up the voices of Kentuckians in terms of what's going on now and what solutions we need here. And I haven't made changes to the resources section since our last webinar last month, but just wanted to make sure that you know it's still here. There are links that you can click for any of these issues or resources. And one thing that I did want to bring your attention to is the upcoming meetings. So we had, because we've been scheduling these for the first Tuesday of every month at 2 o'clock, we didn't realize until last month that November 3rd is election day, and we don't want to have one of these webinars on election day. We want you out there voting and getting out the vote, making sure that you're helping people get to the polls, whatever it is you're doing that day. So we will be having our webinar in November, on November 10th, but this is also going to be different. The format is going to be different and the speakers are going to be different. So this is going to be the first of a series of quarterly forums that we're doing in partnership with the Cabinet for Health and Family Services. So we're really excited about this. I anticipate that we'll have probably some of the commissioners, maybe Deputy Secretary Banahan on the call with us on November 10th, and we'll be able to get updates on Medicaid enrollment, SNAP enrollment, the various things that are changing, the SUD waiver, lots of things that are happening there, Connect, of course. And we have been asking, doing an open records request for data by race and ethnicity, and I know that's work that the Cabinet has been doing internally to get better data, to kind of clean up their data and to present it in ways that would be more effective. And so I'm hoping that we'll also be able to see data disaggregated by race and ethnicity and talk a little bit about what those disparities look like and how the cabinet is planning on addressing them. So just a little preview for what we're going to be doing on November 10th. Then we'll go back to our regularly, scheduled Tuesday meeting on December 1st. And I'll have registration links in our follow-up email for those. And of course, we'll be sharing those on social media too. So hope that you can join us and can share that information with your networks. And then we still have the training that Dr. Sheila Schuster did earlier this year on Advocacy 101 is still available as a recording. And we have CEUs available both for these sessions that we're doing, the ThriveKY policy updates and the Advocacy 101 training. And those CEUs right now are available for licensed social workers and certified community health workers. So you can get in touch with me if you need a certificate. And here are contacts for all of us. And if there are any questions, what time do we have now? We have a few more minutes if any questions are still out there, and if not, we can end early for once. Any questions? Any raised hands? I think you're muted, Kara.
Just checking. I thought we had a question, but it was really just somebody else coming to join us.
All right, well, thank you, everyone. We'll end early this month, and I hope to see you on November 10th. And please remember to vote and to complete your census and to make sure other folks in your networks do too. Bye. Have a good afternoon.
Bye.